from my aspect, what makes a good full arch is, a case that's ethically ready for a full set of teeth removal, patient that we'll say behaves well in surgery, is of the right mindset, ready to go, goes smoothly, is safe, all of those typical things. Yeah. But then there's the other side that you deal with a lot, which is,
everything. Yeah. I mean, on my end, obviously financing and prescriptions and all that stuff, just getting it prepared for you aside. I think for me, it's a lot of, we've talked about in the last episode, the psychology behind it for patients. My main priority is the patient happy? Are they, mentally doing well throughout this process? Or, I think I feed off of, I don't even know what that personality type is, but I feed off of that energy. And me being one of usually the first, team members that they meet during that consult, I pick up quickly their personality. So if they're not that same bubbly person, in that consult or before surgery, and then it's day 3, I'm like, okay, immediately go to the team, I'll go to our team, I'll go to the doctors, hey, let's figure out what's wrong with this patient, and it can be as simple as their stomach hurts from, just whatever. It's nothing, at all related to us. But for me, it's making sure that patient is happy from start to finish, really. So.
Yeah. What does the profile of the patient, does it vary a lot from sort of beginning to the middle to the end? Do they all sort of follow the same ebb and flow, sort of roller coaster-y kind of ride? Or are there trends that you see, or are you able to kind of pick up sort of initially how everything is going to go?
I'd like to think I'm pretty good at picking it up from the start, and it is an emotional time, so I don't judge anybody on that, roller coaster of emotion. Super emotional. So, but yeah, I think I can get a good feeling for the patient, and again, I'm there to make sure that their treatment is good from start to finish, or at least that's my goal. But I would say it is similar trends, whether it be the day of the surgery, maybe a little bit more emotions. It's normal to have, not even in the chair, it's more so the prior to going back, some tears or maybe excitement. It's a very emotional day for them. They are a little orally sedated, so that I think helps. But to the next day, it's them being like, wow, surgery was way easier than I was expecting, and I don't remember the positives. And then it's again another, I want to say loop of the roller coaster is trying in the first set of teeth and managing expectations of, hey, this is our first try-in, this is our first prototype. Tomorrow, and 90% of patients are over the moon already with that little preview they see with that first day. And then this next day, it goes up and down. Then it's the finals, and maybe day 3, it's the peak of pain. So It is just managing that roller coaster and making sure it's nothing that we can tweak on our end to make it smoother for them.
The yo-yo of emotions.
Yeah.
For sure.
Yo-yo. And I'm an emotional human being as well. So again, it's just making sure that if it's something we can do, we'll do it. If it's just the healing process, we're there as a friend for them.
Yeah, I mean, I think we all are drawn to have empathy and try to fix anything that needs to be fixed. But there is a sort of mechanical part of it that just it is what it is. And so you just have to be support rather than, adding to or trying to fix it.
Yeah.